Okay, hi everyone. I just wanted to put this up on Quora, mostly because I'm way too lazy to type out everything that I want to say, and secondly because I wanted to wave and show my face. A few friends have been checking on me and making sure we're okay as our household gets over COVID, and yeah, this is how I look. Probably day 6 now. I also wanted to just talk about a very interesting result that I got back this morning, which is that so my wife and 6 year old are both PCR positive, and of course we've all been cuddling and doing everything normal and all this sort of thing. And I was very mildly symptomatic when I went and got tested with them. Well, let me tell the story correctly. Our 6 year old had high fever and croup symptoms on a Wednesday in the early morning. We both got sort of tickling coughs and sinus congestion, and we went and got tested the next day. We were going to be tested anyway because me being a healthcare worker and him being symptomatic like that, we have to presume that we're close contacts. With New South Wales the way it is at the moment and Sydney's extremely high case numbers, it's the 29th of December today, our PCR capacity has been overwhelmed, unfortunately. I was called by the Douglas Hanley Laboratory. They're doing a really good job. They're doing the best they can. But I heard about my wife's result 2 days ago. Yeah, which would have been effectively day 4 after she was tested. That's the sort of volume they're dealing with at the moment, and they called me because I'm a healthcare worker and a GP. So they were contacting me as a high risk sort of person, which was great. But my own PCR didn't come back until effectively another 30 odd hours after that. So my test, which was done on the 24th, I believe, let me just check, yes, collected on the 24th, I received that result on the 20, late on the 28th, late last night. So interestingly, it is negative. Um, and this is just what I wanted to give my speculation about, because I do think that's a true negative. It was a test done in a symptomatic context with two positive family members at the time. We didn't know that my wife's was positive, but hers was taken literally at the same time as mine. They were good samples, lots of spit and snot, both anterior nares and nasopharyngeal swabs. So I think it is indicative of what's being observed in the UK and in Israel, being that people who are highly vaccinated may shed very little. And this is very encouraging. Of course, we don't want to project too much off single personal experience and whatnot, but there have been some studies of healthcare workers that have failed to transmit when they've been infected at work. And of course, those are vaccinated healthcare workers in the UK. But also, when we look at these couple of papers, which I think are relevant, this one, which is still on the preprint server from Israel, showing lower viral load for vaccinated individuals, but also this paper was published, I initially saw it on the preprint, but came out in Nature Medicine in August, looking at the UK experience, showing no real difference between AstraZeneca, which I'm a huge fan of, and the Pfizer designs, but it does show that they're seeing a reduction in viral load as well, which I think in Omicron's sort of outbreak here starts to come to bear on our isolation procedures and how we approach this as a community, especially in somewhere like Sydney, where we have a very high vaccine uptake, approaching 95 or over 95% for our population over 16 now. Because I think we can, now this is speculation, I don't intend to give this as health advice. We should all be following the current advice from New South Wales Health in our jurisdiction here. But I think we can expect to see very mild illness like mine. I've said to colleagues that on the day I got tested, I had a tickle in the throat and some sinus congestion, but otherwise, if I hadn't had a febrile child and a reason to go and be tested, I might have had a cup of coffee and called it a 6 out of 10 day, cleared my throat and gone to work, wearing a mask and whatnot. But with patients like me who've had 2 AstraZeneca doses and a Pfizer dose, and my wife having 2 AstraZeneca doses, I really think we can expect to see extremely mild disease. Now, of course, in younger populations, I'm 39, she's 40, we expect to see relatively mild disease anyway, but this is what we were hoping the vaccine program would achieve, which is there is a vast difference between having a current infection of SARS-CoV-2 and having to effectively raise a militia while that's going on in an unvaccinated scenario versus having a standing army that is at least moderately well equipped, even against a previous strain. We do see cross-reactivity. The data for especially the AstraZeneca T-cell effect now is indicating that a strong cellular immunity, the division of the immune system which is dedicated via the T cells to already infected cells, trying to clean up what has already been infected, is not terribly variant between strains and is effective between strains. And our what I like to call air defense, our missile defense system of the antibody sort of circulation via B cell, plasma cell production, does have cross-reactivity, and the sort of indications of the effects of boosting with mRNA vaccines like Pfizer and Moderna is very, very encouraging. Looking at my case, of course, don't extrapolate too much from personal experience, but other similarly triply vaccinated healthcare workers, honestly, I think we will be able to keep working almost no matter what, because the degree of illness is so mild. I get flu shots every year. I haven't really had an influenza A since 2009 or so, and I think that's the sort of thing that we are seeing in the community now, with a degree of background immunological experience, with some relevant T cell populations and a degree of circulating antibody immunity. We're not going to need to isolate people as much, I don't think, especially when there's the possibility that mildly symptomatic cases may even be PCR negative or even RAT negative. And this raises a real problem. We're already seeing that perhaps 50% of the pediatric population under 12, when they're presenting, are asymptomatic at the time that they're positive. We have already found one other family that we probably infected at a pre-symptomatic stage with our 6-year-old. Of course, you know, we've been as cautious as we can reasonably be. There was no reason for us to suspect that he was infected, and he was completely asymptomatic at that point. But I think that as this now moves through the Sydney population, New South Wales and Australia as a whole in a highly vaccinated population, we're going to see this behave extremely similarly to seasonal respiratory viruses like human metapneumovirus, the parainfluenzae and the flus themselves in a vaccinated population, because there is going to be the speed at which those infections are going to be controlled. My wife, having not had the mRNA booster yet, had a mild fever, 38 degrees, and effectively was a bit yucked for 3 days. And our 6-year-old was over it, completely asymptomatic by 72 hours. And to me, what this means practically is that as we go back to school after the summer holidays and whatnot, there is going to be no practical way of reducing spread through schools. These children are likely to be minimally ill or completely undifferentiable from even hay fever. So I think that's going to pose some problems for us practically. I think we're going to need to change some isolation rules, but really we've got to get our remaining population vaccinated, because even though we did see with low exposures, with small viral loads, people with passing contact, people who are not inhaling complete bloody lungfuls of ICU air like the poor Italian ENT surgeons that ended up as some of the first fatalities, even though we do see very mild illness even in the wild type, the real problem is this shedding effect, and the likelihood that as an uneducated immune system is trying to both adapt and control an infection on the fly. I always use the example, it's like raising a militia. Of course, no vaccines ever prevent infection. The only way to prevent infection is to stop a virion crossing a mucosal barrier. So that's why we wear spacesuits in ICU. But so we are going to see effectively the whole population get exposed like they do for rhinovirus and influenza and every other respiratory virus we deal with. But of course, with immunological education, with a background cell sort of population available, those of us that are vaccinated are going to control this infection very quickly, and possibly control it quickly enough to be completely asymptomatic and or not shed, which is what I think may have happened in my case here, and there does seem to be some evidence elsewhere in the world that that's happening. So I just wanted to put that up as a speculation, as a sort of premonition that we will be seeing changes in public health responses, as we already have had today. We got a message from the Chief Health Officer, New South Wales, Kerry Chan, instructing us that our low-risk patient age limit has been raised from 50 to 65. Because thankfully we are seeing this degree of mild illness, but with this speed, I do worry about any unvaccinated parts of our population remaining. The sub-12-year-olds are possibly lower risk, but Omicron is incredibly infectious from what we're seeing. We're seeing transmission even in scenarios where people are appropriately spaced, even scenarios where all appropriate things have been done under the current guidance. And so I think it is going to sweep through. It is going to produce a degree of wild type immunity in the Sydney population and the Australian population as a whole, in exactly the same way that an influenza virus does with a new strain annually, or more than one, of course. However, this raises the stakes in terms of vaccination. As I was commenting to a nice microbiologist I know, when influenza first entered the human reservoir, we would have seen a very similar massive morbidity and mortality. Yes, with some low-grade disease as well, in keeping with variations in immunological population properties between people. Having said that, I think now is the time to ensure that whatever sectors of the population are still going to encounter this without any sort of prior experience, that needs to change. But at the same time, we can be encouraged that the vaccine program has done what we hoped in producing a resilience in our community, which is expressing itself in terms of asymptomatic and minimally symptomatic illness, and a lower degree of viral expression, as I think is being expressed in my PCR negative result. So I hope at least a few friends are encouraged by how I look. I actually did some work today, kind of just like this, over telehealth. Just giving a little bit of advice and encouragement to friends in very similar situations and other households in similar situations. I do think this won't be a terribly long-lived affair by any means, but we do want to reduce red. We do want to reduce pressure on our hospitals. We're at about half the inpatient amount that we had at the peak of the Delta outbreak now, and for that reason, I think we all want to be isolating appropriately as we are. But I really think that now the focus is going to change from preventing spread in the general population to preventing spread in special populations, and the unvaccinated remainder of our community is very much that special population. So I hope there is almost no one that is unvaccinated by the end of March. And hopefully we can look forward to the upcoming strains of COVID-19 behaving exactly as our normal seasonal viruses do.